back to the Advancing Healthcare Innovation Show. I'm your host, Michael Stamatinos. And if you're new to us, we are extraordinarily passionate about healthcare innovation and adoption. And our objective here is to bring real stories from real people that are actually innovating within healthcare. And we've got just a phenomenal year that's action-packed with great content, great interviews, and we're just delighted to be able to bring a wonderful guest to you. And I just want to encourage you, wherever you are, if you like this content, I just want to encourage you, if you're consuming it, hit like, hit share, subscribe. We'd love to hear what you think about it. And today, I am just delighted to have a wonderful guest today, Mona Hayat, and she is the CEO of Nexus Digital Technology. Mona, welcome to the show.
Thank you very much, Michael. I'm delighted to be here with you.
Awesome. Well, Mona, from our first conversation that we had, I knew that I needed to have you on the show. And your background just struck me from just the depth of experience. And I'd love for you to maybe just take a minute or two and share with the audience a little bit about your background, just because you come from a very unique space, given that the NHS in the UK is sort of a single unified payer system. I'd love to hear a little bit more about that and how you were innovating within that space, and then now taking the next step. So take it away.
Sure, Michael, I'd be delighted to. Just by way of introduction, I, up until 2019, spent 25 years working within the NHS here in the UK, mainly in the London region and the South East. And I started my time in the NHS back in the 90s, where I was a clinician. And I was a clinician in mental health specifically. So I worked across a number of mental health organisations in the form of rehabilitation, day programmes, outreach work, some of the more acute end of mental health experience. And from then I moved further up the ranks, so to speak. So from clinical services, I ended up I guess inevitably in the management side of delivering both physical and mental health services. And then latterly in my career, in the last 10 years, I moved over to commissioning. So that's really when I started to get involved in true transformation in the context of service redesign and deploying new and different kinds of innovation within NHS environments, whether that be in acute hospitals or within community services, or maybe within mental health trusts. And then the very last job I did when I was in the NHS was I was the executive director responsible for the delivery of both mental and physical health services for the Grenfell Tower incident that took place here in the UK in 2017. So for our listeners that may not know about the Grenfell Tower incident, there was a tower block that was basically, unfortunately, went on fire. And that was due to an electrical fault on the 5th floor of the tower. And the tower was 24 floors high. And that was in June 2017. And it was already a very hot day, very unusual for the UK. But sadly, as a consequence of that fire, 72 people lost their lives. And so I was, after the first responders were brought in, it was then down to myself which was a small team of commissioners and the providers to come together and develop what was going to have to be something that was very unusual for NHS services to deliver. And the reason for that is because the tower consisted of residents whom their backgrounds were that they were not all from the UK. So their country of origin tended to be from abroad, a huge variety of countries. But of course, with the occupation being so diverse, and sadly, some of the members, some of the residents in the tower having experienced trauma in their country of origin, it was particularly sad and difficult that they then ended up in a situation where they were being re-traumatized by this really sad event that took place. So, so it was an interesting job, and what we had to do was unlearn what we had always learned in the NHS, of which I'm a huge fan of. But what I mean by unlearn is, you know, the NHS is a fantastic institution, and I will always praise it hugely. But I think they're still on a learning curve, like a lot of healthcare organisations, around how to adapt and adopt and employ strategies and interventions with diverse populations. So whether that be about health inequalities, or whether that be about diversity in race, ethnicity, culture, sexuality, etc. So we almost had to put down our westernized, Eurocentric way of delivering healthcare services and really get to the heart of what is it that this population needed. So if I were to give you an example, there was quite a high cohort of a Moroccan community who lived in and around that area and had lost loved ones to the fire. And as a consequence of that, a lot of them were Muslim in terms of their religious background, and therefore trying to do a mental health assessment on a Muslim woman and asking her if she was feeling suicidal would not have gone down very well, because of course within the Quran it's haram to take one's own life. So that would have caused a lot of confusion. So what we had to do was find innovative techniques, creative techniques of working with these community members. And consequently, we did that through the medium of cooking and different activities within the community where people came together, and it enabled them to feel emotionally safe, to then starting to get into the narrative of how they felt about their experience to do with the fire and the loss of their loved ones. So after that experience, I felt it would have been impossible for me to go back to what you or I would call a normal healthcare job. And as such, I left the NHS and set up Nexus Digital Technology in September 2019.
You know what it sounds like? It sounds as if you've gone to war, you've experienced something that most can never even imagine, and then coming back from that type of place and then trying to blend yourself back into normal society is extraordinarily difficult. And then you start to see some of the gaps, and therefore you say, well, there needs to be something that's done about it. How, in your time with the NHS, how has your view of innovation, or how you've defined innovation, has it changed, and what has it evolved to?
I think that's a really interesting question, Michael, because if I were to just speak specifically about the example of the NHS, which is, of course, is the institution I know the most, I think there is the potential for innovation is phenomenal. There is no two ways about it. But what I think is really interesting is I think that there's a bit of a split between our clinical colleagues within the NHS and the administrative managerial side. Without a doubt, I have experienced throughout my career a real deep interest in innovation, particularly in specialties and subspecialties within, for example, acute trusts, hospital trusts. And that always comes from the clinicians who want to learn more, do better, find new different techniques. I think where we've come unstuck in terms of maybe the NHS being a little bit slower behind the curve of innovation in comparison to other healthcare institutions globally, is that the institution of the NHS remains quite bureaucratic, and there is, managers have to make difficult decisions about budgets and, balancing quality with efficiency. And I think that that's, having been an ex-commissioner myself, I think that's always a really, really tough call to make. But at the end of the day, for me, innovation within healthcare, and that's not specific to the NHS, I'm talking globally here, is all about being visionary. And actually, for me, a lot of what stops us from moving forward with innovation is fear. Fear of the unknown, fear of change, fear of impact. So I think that there is a lot of visionary people who operate in the healthcare space, and I know that there's going to be some of them listening to us right now who no doubt will agree with me, but I still think that we have a long way to go in order to make really big strides forward, to bring in the level of innovation we are going to need in order to tackle what is ultimately now a global healthcare problem, which is that we have, even before the pandemic, the predicted year-end spend for global health looked at $8.7 trillion. I have no idea what it is now, but I think we can both predict it's going to be pretty much off the scale, and it will be that way for a while. So if we're going to address, lack of funds, an aged population, with an aged population comes people who are living potentially with one or several long-term conditions. And in addition to that, a culture, and this is a global culture again, of not really focusing in on prevention as much as we should be, still very much being reactive to healthcare in as much as I get sick, i.e. that means I go and see my physician or my GP, and that means I then enter the healthcare system, until we reach a point where we're able to get our innovation up to a standard whereby that's no longer happening, and there's an understanding of the way in which the healthcare system can empower citizens to take control of their own health and well-being. I think the trajectory is looking a bit bleak at the moment, unless we're able to address this very issue.
Yeah, in America, there's been a shift over the course of the last decade in moving more towards value-based care, which in essence means that a provider is being rewarded for keeping patients well and out of the hospital.
Yeah.
Versus the traditional form of payment, which is a fee for service. Like you mentioned, patient gets sick, they go and see a provider, they get better, provider gets paid for those services. So we're starting to see a little bit of a shift towards moving towards the risk-based type contracting. Sort of shifting gears a little bit, you've left NHS now, and what particular problem are you very keenly focused on right now in terms of solving?
Well, it's really interesting that you mentioned value-based care, because I would agree with you that I think the US is moving in that direction. I also think it's making traction, that very point, in the UAE, interestingly. The UK has been trying to develop value-based care, but in my experience as a commissioner, and this does answer your question in terms of the problem we're trying to solve now, what we found is that we tried to employ, again, the very same strategy, which is to get community providers to be accountable for preventing patients from entering the healthcare system. But interestingly, what early findings have indicated that all that's doing is increasing demand management, because there is still patients going into hospital for elective care or for outpatients appointments. Then there's been a surge, an increase in patients accessing community services. And I think where we haven't really quite redressed the balance yet here in the UK is working with primary care, because a lot of having a successful value-based system is very much predicated on the success of primary care referrals, or people being able to have their healthcare issues addressed at primary care level. And I think we haven't achieved that yet. And so that has really influenced what we have developed with Nexus digital technology, which is basically we produced a behavior modification platform. And that behavior modification platform is all about empowering people to take control of their health and well-being, and linking people to brands and devices and information and education hubs. So actually what they get to do is be in an informed position to be able to make sustainable long-term lifestyle choices. So we are coming from the angle that we assume that people don't know what they don't know. So one of the 6 areas that we cover for Nexus is that we put together a central repository of services, of fantastic health and wellbeing services, under 8 different wellness pillars. That's physical health, mental health, sexual health, social, environmental, financial, spiritual, and intellectual. And if somebody clicks on one of those icons, they will see a whole range of incredible affiliate companies that offer innovation in that particular space, whether it's physical health or social wellness or environmental wellness. And these are services that they would not necessarily have known about had they gone to see their physician, for example, or they certainly wouldn't have known about it because they wouldn't have Googled it. They wouldn't have even known these services existed. So we have a central repository of services. People have access to a health coach. We're aware that not everyone is into health and wellness. There's going to be a lot of people who are frightened and overwhelmed at the thought of using a health and wellness app. But we've deliberately gone for uh, a very clear value that what we don't want is to be prescriptive. So a lot of health and well-being apps tell us that we have to walk 10,000 steps a day, we've got to eat clean, we've got to do this, we've got to do that. What we're saying is, hey, Michael, the term wellness may mean something different to you than it does to me. And so it's for us to personalize how much we can manage, do as little or as much as we possibly can in the early days, check in with our health coach, who's there to really support us, to be our wellness support on our journey, and to celebrate the wins, and also, you know, to understand what is the best wellness package of care for me. So when you go into our platform, somebody would fill in a health and wellbeing survey. The results of that would produce a set of personalised algorithms that the health coach would be able to see, and to help you decide which activities and which services you want to use. So that's the gist of what we do. There's also an education hub and a Nexus community, which is very much moderated for regulation purposes, but it gives the opportunity for peer support and to have an awful lot of access to learning tools, videos, vlogs, blogs, which, you know, we know from uptake is incredibly powerful for our Nexus community. We have over 80% uptake of people using the education hub, for example. So I think the pandemic has kind of positioned the world in a way that, very sadly, it's very bittersweet, but definitely it's raised health and wellness above the parapet, so to speak, in terms of employees, employers, institutions across the world being much more aware of the necessity of us to really address health and well-being, but also the parity between mental health and physical health being equally as important to address.
You know, it's amazing that with health today that physicians don't really have access to this type of information. Have you found it that physicians are open to having communities of connectedness such as this in some of your preliminary research?
Yes, I'm absolutely sure. I can only speak for the UK and to a degree the UAE at the moment in terms of the space that we're operating in. I think that we've had phenomenal backing from our clinicians, and not just from primary care, but also from hospital trusts that really see the value in what we're delivering. You know, at the end of the day, I can only imagine that if I was a specialist consultant in a particular subspecialty, I would find it disheartening if all I was dealing with is patients who are coming, you know, revolving door patients who are coming back around the system into emergency departments because maybe they've acquired infections or secondary conditions. You know, as a specialist, I want to do the exciting, innovative work. And at the moment, our healthcare systems don't really allow for that to be happening within hospital trusts, simply because they're utterly overburdened with the sheer volume of patients coming through the system. And for me, that's very, very much about education and you know, giving citizens the tools, the knowledge, and the information, and sitting back and seeing the longitudinal outcomes of that, which is exactly what we're doing with Nexus. So we have a site with Guy's and St Thomas's Hospital here in London. We are working with prostate cancer patients. We've deliberately signed up to the pilot being a 2-year journey. And that's because we actually really want to see the long-term outcomes of what happens when a patient is given the choice to engage in the services that we offer. Not instead of, I must emphasize that, Michael, of course there is a place for medical interventions, and of course we're working with cancer patients, so it's critical that they undertake their cancer treatment. But actually what we're doing is we're just creating a swim lane, an alternative, a supportive alternative for patients, which will enable them to not always have to defer to healthcare to address their physical and mental health symptoms and diagnosis.
There's something to be said about having dignity and choice.
100%. I fully agree about that. We talk a lot in healthcare about patient choice, and I'm a big advocate of that. And I think the healthcare industry attracts well-meaning people who genuinely buy into that philosophy. But the reality is, another issue we're still addressing is that we don't really live in an environment where there is, again, parity regarding patient choice, because, again, difference and diversity means that some people have more choice and more opportunity than others. And one of the things we're trying to do in Nexus is also address that. So people can use our app through their language of choice. They can use voice activation, maybe if digital, they're not digitally literate as much as maybe others, or they can even use our app through the medium of their television at home with a really simple remote control. Because maybe if they're isolated or possibly immobile due to health reasons, at least we can bring services into their home, and citizens still have that potential to feel empowered and in control of their interactions and how they manage their health and well-being.
Innovation is important to have great partners, and it sounds like you found a partner now that wants to go the distance with you. Have you found it difficult to find partners that are willing to go a 2-year sort of study per se?
Interestingly, less so than we were anticipating, if I'm honest, Michael. So, for example, in the UK, there is a term for what Nexus is delivering. It's called social prescribing. I guess it's a verbal spin on pharmaceutical prescribing, which is, of course, what clinicians do. And there's been a philosophy here in the UK for a while that's come down from, the Department of Health and NHS England, that social prescribing is really for doctors to prescribe for patients to go away and engage in social activities to improve their health, rather than, medical prescriptions. And so that's where the term came from. But I have to say, it's very, very early days in the US, but I'm really excited about the fact that this term has started to slip into important research papers within the US. And I think that there is now some real appetite to engage in well-being and mental health and well-being, actually. If you look at it from an SEO point of view, the terms that US citizens Google the most in the context of healthcare is either wellness or mental health. And that speaks a lot about, what US citizens are concerned about right now. And we can't miss a beat in understanding that this is what their needs are right now. So I think the US is really starting to see the value in social prescribing as a term. And with the UAE, if I'm honest, it was a little bit easier than I thought, because I think, government ministers, the government in general across the whole of the UAE is really concerned about chronic health conditions, particularly obesity and diabetes, which are the top two real concerns over there. But, to a lesser extent, of course, heart disease, respiratory diseases, cancers, and now mental health is really starting to be acknowledged as being a part of those top 6 conditions that really need addressing. So I think there is some real open-mindedness from the government institutions in the UAE to look at alternative ways of getting their citizens to engage in wellness that isn't just, again, healthcare centric.
Why do you think that is? What gives them that sense of openness versus, other areas of the world?
I think the UAE has been subject to a lot more health tourism for a good start. So they've had diversity of the footfall of patients that they've seen engaging in their healthcare systems. I think that the healthcare industry in the UAE is very well funded in comparison to maybe other territories across the globe. There's been some real investment in healthcare over the last 20 years. And, in some respects, the UAE has gone from a blank sheet a couple of decades ago to running some of the most visionary, innovative components of the healthcare system that other parts of the world are really deferring to now. Throw in value-based commissioning over there, which is very much now on the agenda. And I think it makes for a potent combination of there being enormous potential around health and well-being in the UAE. And also the UAE are very good at looking at what's going on in terms of innovation in other territories as well, other geographical areas. Especially in the early days, the UAE used to defer a lot to the US and the innovation taking place and that continues to take place in the US. So they're very good at learning, they're very good at educating, and I think they're also really good at implementing. So, so I think that momentum is really growing in the UAE, and I think they're going to be one to watch in the healthcare space, or to continue to watch in the next 10 years.
Yeah, it really comes down to the execution, the implementation. So let's just fast forward a year from now, and we're having this conversation again. What needs to happen in order for you to feel satisfied with what Nexus Digital Technology is doing?
I think we would be really happy about scaling up with hospital trusts, with different cohorts of patients and specialties and subspecialties that are particularly related to chronic diseases and the recurrence of chronic diseases. So if we were to scale up in the UK and gain some traction in the US with US hospitals, I'd be delighted about that. We're also going on a journey in the UAE at the moment around having those discussions with some hospitals over there. So I think really scaling up our B2H model would be a great place for us to be in a year's time. But in addition to that, we are very much working on our B2C model as well, so that it won't be long, it'll be about 3 or 4 months till our new tech version comes out and anyone will be able to download our app on, Apple or Google Play, and go in and have a play and see what our app's about and how they can get that support from health coaches and all the other resources that are on the app. And we're really excited about that. And lastly, thank you. And lastly, just to say that we've developed a training arm of Nexus where we are training individuals in health and wellbeing coaching. So once people are trained, they then enter the Nexus family and can do as much or as little sessional work as they want to do as a coach. And we just think in terms of inequalities, again, that's great for maybe single mums who are looking after their children, or those of us who are looking over, who care to elderly parents, or basically people who need to fit work in and around commitments they have in their life. And we just think that's a great churn to be able to have, a high number of health coaches, but also maybe people who've engaged in using the healthcare, our Nexus app, enjoying it so much that they have an interest in becoming a health and wellbeing coach themselves, and therefore have that opportunity to train.
That's fabulous. I mean, so what do you think is the best way for people to kind of continue this conversation and get a hold of you? I mean, where can they follow what you're doing?
So we have a great website, which is www.nexus-dt.com. People can register with our product on that's one of our omni channels, so they can register to have a look around our product on the website. And if they want to get in touch with us, there's an email address there, info@nexus-dt.com, and myself or one of the team would be really happy to get back.
This is awesome. I'm so delighted that you came, just to even give us a little bit of a glimpse of how innovation is done outside the boundaries of the US. I mean, healthcare innovation is a global thing that we're focused on. It's not just here in America, it's all over the world. And look to our audience, if you found this content helpful to you, I certainly did. Social prescribing isn't something that I've been very well attuned to. I mean, we hear the verbiage of social determinants of health and things like that, but social prescribing isn't something that I've been really well aware of. So I've been very well informed here. But again, for those folks that are listening in, share. like it, subscribe it, comment on it. We'd love to hear from it. And I'm so grateful because having more folks coming into our community to advance healthcare is actually what allows innovation to continue to flourish. So it's about leadership, it's about visionary, about seeing things ahead of the curve. And it's just been wonderful to have you here, Mona. So thank you so
Thank you
much.
so much, Michael. I've been delighted to be with you for the last half an hour. Thank you indeed.
Well, I look forward to our next conversation.
Thanks a lot.
Bye for now.